All right, tonight we are diving into a policy shift so big, some are calling it an economic declaration of war on the entire global pharmaceutical industry. This is the story of TRUMPRX and what it could mean for the price you pay, well, just to stay alive.
You know, it's a tax that isn't passed by Congress, and it's definitely not collected by the IRS. It's a tax you pay at the pharmacy counter every single day. For decades, it's just been this painful reality of American life. But to really get what's changing, you first have to understand just how big the problem was.
I mean, just look at this. The picture here it's stark. This isn't some small difference we're talking about. It is a chasm. For the exact same pills, made by the exact same companies, Americans have been paying 2, 3, sometimes 10 times more than people in other developed countries. We've effectively been subsidizing the world's medicine cabinet. Well, until now.
Because this system, this long-standing, seemingly unbreakable setup, it just ran into a brand new disruptive force, a direct challenge to the entire pricing structure of American healthcare.
The day that Sledgehammer struck, that was the day TRUMPRX.gov went live. And look, this isn't just another clunky government website. The administration is pitching it as the weapon they're using to dismantle the ridiculously complex and murky system that has controlled drug prices for a generation.
Its real power is just how simple it is. It's nothing like healthcare.gov, which is a whole insurance marketplace. Nope, this is a direct pipeline to the drug makers. You search your drug, the site points you right to the manufacturer's own cash pay platform, and you buy it directly. That whole tangled web of middlemen, you just sidestep it completely.
And these guys, these are the primary middlemen the site is built to get around. They're called pharmacy benefit managers, or PBMs. For years, they've been the invisible hands in the shadows, negotiating all these rebates and fees that just jack up the final price you pay. The administration calls them vampire middlemen, and this new portal, it's like a digital stake aimed right at their heart.
The impact in the real world is, well, it's seismic. Let's take Ozempic, that popular weight loss drug. The list price can be over $1,000. Now, it's available for as low as $350. The blood thinner Plavix, it could cost you over $750. Now, $16. If you're a consumer paying with cash, this is nothing short of revolutionary.
But that brings us to the million-dollar question, right? Pharmaceutical companies are famous for protecting their profits. So why on earth would they voluntarily agree to slash prices this drastically? Well, the answer has very little to do with healthcare and absolutely everything to do with geopolitics. Yeah, this wasn't some friendly negotiation over coffee. This was a high-stakes geopolitical showdown that used the full economic power of the US market to force these companies to change how they do business globally. This one quote from launch day, it perfectly captures the administration's whole strategy. The argument is pretty simple. The sky-high prices Americans pay allow drug companies to sell their products for way less in countries with socialized medicine. This policy is designed to take that logic and just turn it on its head.
And this is the weapon they're using to do it. It's called the Most Favored Nation, or MFN doctrine. Essentially, the administration delivered an ultimatum to the world's biggest drug makers. It said, you must give American patients the absolute lowest price that you give to any other developed country on Earth. Period. It was a classic pincer move, a carrot and a stick. The stick was a threatened 100% tariff on any drug from a company that didn't comply. I mean, that's a death sentence for their business in the US. The carrot, though? Cooperate. Join TRUMPRX.gov and you get Most Favored Nation status, tariff exemptions, and even get your new drugs pushed to the front of the line at the FDA. It was, you know, an offer they couldn't refuse.
But the deals went even further than that. As part of these agreements, the pharma giants also had to commit to this staggering number, a $150 billion investment in building new manufacturing plants right here in the United States. See, the plan was never just about lowering costs. It was about reshoring a critical supply chain. I mean, the pandemic showed us all just how dependent America is on China and India for essential medicines. So this policy ties access to our market directly to domestic investment. It's about national security. It's about a concept they're calling biosovereignty. But of course, a government rollout of this magnitude is never without its critics, its glitches, and its unintended consequences. And the skepticism around TRUMPRX is significant. As soon as the site launched, critics pounced on the delays and technical problems. Some media outlets just dismissed it as a flashy PR move that lacked real substance from most Americans. And their main argument really hinges on a crucial detail about how our crazy insurance system actually works.
This is what they're calling the list price illusion. So those huge price drops we saw earlier, they're based on the manufacturer's list price. But if you have good insurance, you probably never pay that price. For instance, if your copay for Ozempic is already just $25, that $350 TRUMPRX price is actually a much worse deal for you.
So the platform's main beneficiaries are really specific groups: the uninsured, the underinsured, and anyone with one of those high deductible plans that make you pay thousands out of pocket before your coverage even starts. For those Americans, this is a lifeline. For everyone else, its direct benefit is, well, it's a lot less clear.
All of this really sets the stage for a fundamental conflict, a whole new kind of healthcare war. And this one isn't fought over insurance mandates, but over the very engine of medical discovery.
And it brings up the central tension of modern medicine. By using government power to force prices down, are we creating a system where drug companies just can't afford to take those massive, billion-dollar risks on research and development? If the potential profit from a new Alzheimer's drug is capped, will that drug ever even be created in the first place? It is the ultimate trade-off.
So the success of this entire experiment now really hangs on these huge, unanswered questions. If drug costs go down, will insurance companies actually pass those savings on and lower our premiums? Will other countries sue, claiming these MFN deals are unfair trade? And, maybe most critically, will this new model kill the golden goose of medical innovation?
Look, the final verdict on TRUMPRX won't be in for years. But whether it ultimately succeeds or it fails, it has already done one thing. It has dragged the shadowy world of pharmaceutical pricing out into the bright sunlight. The curtain's been pulled back, and for better or for worse, the American patient is never going to see the cost of their medicine in the same way again.